All right, here she is, Dr. Ranney, saving the day. Thank you so much. She is an emergency physician and associate professor at Brown University. She is also the co-founder of Get SPPE. We have not talked to her in a little while, but we are back in an old situation, so we need your guidance, Dr. Ranney. We got to talk masks again. It's starting to get a little bit confusing. For weeks now, the CDC has been saying that vaccinated people don't need to wear masks. Now they're saying even vaccinated people should wear masks in areas with low vaccination rates. And so you have a lot of people sitting here thinking, well, is that me? What do I do? What should our viewers do? They could use a little bit of advice. What do you say?
So the really easy advice is, regardless of what the CDC says, think of what I and other public health professionals have been saying for a few weeks now, which is that if you live in an area where COVID is surging, and therefore the Delta variant is surging, you need to wear a mask when you're indoors in a public place. That's because Delta variant is super contagious. And if you're in a place where it's surging, the chance of your being around someone is high. The last thing that's changed that has led to the CDC change in recommendations is there's some new evidence that maybe if you're one of the unlucky few who catches COVID, despite being vaccinated, you may actually be able to pass it on to other people in your household, family members, immunocompromised folks. That's part of what led them to the shift. But the big thing here, if you live in a place that's a surge, wear a mask in public indoor locations, but you're still fine outdoors, or if you're with purely vaccinated people in a private setting.
All right, so let's talk a little bit more about the data and the Delta variant. This is, of course, the big concern. It is spreading fast. As you've mentioned, the data suggesting that fully vaccinated people are not just getting COVID in some rare occasions, but they could also be infecting other people. Here's what CDC Director Dr. Rochelle Walensky said about that today.
The Delta variant behaves uniquely differently from past strains of the virus that caused COVID-19. Information on the Delta variant from several states and other countries indicates that in rare occasions, some vaccinated people infected with the Delta variant after vaccination may be contagious and spread the virus to others.
So, Dr. Ranney, I have to ask, is this new mask guidance too little, too late, or can we do things to reverse the course on this pandemic, to slow down or even stop the Delta variant before this fall, this winter, when we know that the virus has a much better success rate, if you will, compared to the summertime?
Yeah, that is exactly it. If we are ever going to encourage folks to mask up again, now is the moment. If you look at graphs of the number of new infections, hospitalizations, and even deaths across the United States right now, you see that they're going almost straight up on a vertical line, but they are nowhere near where they were last fall. So this is the moment where masking up can stop that transmission. Well, we also get more vaccines in arms, because even with this new data about Delta variant, Allison, this is the important thing. The vaccines are still amazingly protective against catching the virus. There's going to be a few breakthrough cases, but not a ton. And more importantly, protective against hospitalization and death. So mask up for now, go get your shot, and let's hope that we can get this under control before September.
Speaking of September, this fall, millions of Americans head back to the office. Kids are heading back to school. What would you like to see in companies and in classrooms to keep people there safe? Is it time for us to start thinking about maybe bringing back some of the old COVID safety protocol, or are we not at that stage quite yet?
It is absolutely time to bring up those safety protocols. Yesterday, healthcare organizations across the country came together to say that it's time to mandate vaccines for healthcare workers. Today, the CDC has said all kids in schools need to be masked in order to keep them safe so that they can have in-person learning. The same standards should be applied to workplaces across the United States. I'll also add on that ventilation is really important in addition to masking until everybody gets vaccinated. And for ventilation, it could be something simple like opening a window, or it can be more complex things like really high quality air filters, which help to draw the virus out if there happens to be someone that's infected.
So great to see you again. Thank you for the guidance today. I know we continue to have questions as that guidance changes. So thanks for walking us through what we should be doing, Dr. Ranney. Wonderful to see you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.